Okay, so the time now is 2 p.m. Eastern, so we're going to go ahead and get started. Hello, everyone. My name is Lisa Marie Pratt. I am the Outreach and Support Specialist with the Association for Clinical Oncology. Thank you for joining us this afternoon or this morning, depending on where you are. Before we begin, I'd like to go over a few housekeeping items. Today's call will be recorded and made available following this event. All participants' lines are muted throughout today's call, but please feel free to ask questions using the chat feature, which is located on the right-hand side of your screen. Questions posted in the chat will be answered at the end of the call. If you have any additional questions at the conclusion of the presentation, please use the raise hand feature and your line will be unmuted so that you may ask our speakers a question. Again, thank you for joining us today. To learn how ASCO's state advocacy team, Segel and Sarah Lanford, can work with your society to advance cancer care policies in your state. Compared to Congress, state legislatures often move quicker, generate less coverage, and pass more bills into law. So with that, over to our state advocacy team members.
Thank you, Lisa Marie, and thank you to everybody who's joined. I know that I've had the privilege of working with many of you already, so it's great to see you guys logged on here. My name is Aaron Segel, and I'm a state advocacy specialist here with ASCO, and we're here to discuss the state advocacy program and how we can best work with our state affiliates. And before we get started, we'd like to put up a quick poll, which will be informative to us, and I'll kick it over to Lisa Marie for that.
So the question is, do you feel like your society is engaged through enough at the state level? And it looks like responses are already beginning to come in.
A pretty split poll so far, and that's what this is for.
Okay, I'll go ahead and close it now and share the results.
Perfect. Well, 5-5. So we have our work cut out for us for sure. And thank you again for joining. And I'll kick it over to Sarah to give a brief state overview.
Yeah, hi there, everyone. Super excited to be here. My name is Sarah Lanford. For those of you whom I haven't had the pleasure of meeting yet, I joined the ASCO State Advocacy team right at the beginning of the year, and as you'll see later in this presentation, we've already gotten a lot done so far this year. So I'm super excited to be here and get to know y'all. And I wanted to start this webinar kind of setting the stage, talk about what the legislative landscape looks like for states in 2022. So as you can see on this map here, 46 states are convening or have already convened for regular legislative sessions this year. You'll see that Texas, Nevada, Montana, and North Dakota are blacked out. Those are the 4 states that only meet every other year. And then another little thing that's throwing this year is a little bit different about this year is that, as I'm sure you all know, it's an election year. And that just means that some states will have shorter sessions, maybe with smaller agendas, and they might put limits on the number of bills any one lawmaker can introduce, especially as some of these states use these even numbered years to focus on biennial budget requirements. So it's just something to keep in mind as you think about how much you can get done in your state this year. And then, as always, each state is different. I think that's what makes doing state advocacy work so fun and a fun challenge. So session dates vary. So, we have some states that are already in, but you'll see Louisiana's in gray. They typically don't go until March or April. And deadlines vary. So some states meet all year, and some states like Virginia have a super quick session. And then, of course, the political landscape plays a really big role in what you may be able to get accomplished. Next slide, please.
Thanks, Sarah. And I know Lisa Marie touched on this a little bit in her opening remarks, but we wanted to make some distinctions between state legislatures versus the federal government and Congress. And state legislatures have a unique ability to shape cancer care because legislation can actually move in the states, and Congress legislation is very slow. It's very partisan right now, and it's difficult to get big ticket items through relating to healthcare. So states can really fill in those policy gaps when there's nothing happening at the federal level. And one example we wanted to highlight that's very relevant to what we do is that in Massachusetts, there was a healthcare law passed in 2006 about requiring everybody without insurance to buy healthcare on an individual mandate or be covered through the state's Medicaid program, and that very much laid the groundwork for the ACA to pass in 2010. So that's just one of many examples of how state policy can really impact and shape federal policy. And states too vary in how often they meet and how professional the legislatures are. I don't mean that in a degrading way. I just mean it in that some legislatures meet year round and have higher salaries, like California and Massachusetts and New York, and others are in for a very short, quick session. Utah, New Mexico, and Virginia, to name a few. And so if you're on the line and you're from California, New York, or Massachusetts, you may not hear from us so much in January, February, March. But if you're in Utah, Virginia, New Mexico, better hear from us in those months, or we've missed the boat. So states definitely vary in how often they meet. They're also increasingly uniform in party. There's only 2 states that have one chamber that's Democrat and one chamber that's Republican, and those are Minnesota and then newly Virginia with the results of last fall's election. So there's a lot of differences between state and federal, even though the one theme that's remained the same is the partisanship side.
So with all that variety, I think our work that we do with y'all, the state affiliates, is crucial. Y'all are key partners in our state advocacy efforts. And as you can see on the screen here, ASCO supports state affiliates by providing state advocacy toolkits and policy statements, which you can find on our website. We analyze a whole host of legislation across the states, which we'll get into later. We draft comment letters in support or in opposition to bills in the legislature. We can also help prepare testimony for any state hearings or committee meetings. And then we coordinate grassroots alerts through our state ACT network, which I know we'll also touch on later. Next slide, please.
Yeah, so here's our state tracker. So this is available to you wherever, whenever, through what's called our ACT network. So you can sort by state, you can sort by issue, you can see it updates in real time, so you can see the status, where the bill is in the process, when it last had action, and then I can take you directly to the bill link. And Lisa Marie can pop the link into the chat right now. And if there's a bill or if there's an issue that's really interesting to you, and your state hasn't introduced it, you can use this tracker to see if another state has introduced that bill or a bill on that issue, where it's gotten in the process, what the language looks like. So this tracker really has a lot at your disposal that you can use, and it's available to you all the time. And you can also if you click the individual state, it will zero in on just your state and what's going on there. So the darker a state is, the more legislation it is that we're watching. Some states are just higher volume than others with bill introductions. Yeah, really a lot that the tracker can provide, and it's very useful. Next slide.
So I wanted to touch on the process for writing a joint letter with our state affiliates. That's probably the way we engage most at the state level. And it's a little bit of a process. I wanted to talk y'all through it. So what happens first is that either Aaron or I will identify legislation that may be of interest to you, or you can bring that legislation to us and we'll kick off the process. But we'll then draft a letter that goes through an internal approval process that ultimately ends with Dr. Burris. And once he approves that, we send the letter to you, the state affiliate, for approval and your president's signature. And then that'll come back to us once all those puzzle pieces are in place, and we'll submit the letter either directly to lawmakers or to a committee where the bill is being heard. Just wanted to flag that we'll write joint letters on something if our government relations committee has kind of given us the green light to weigh in publicly. But even if we don't have a policy position on something that you find you'd like to weigh in on, we can help you work behind the scenes to kind of weigh in on that way. Next slide, please. Oops, one back, I think, Lisa Marie. There we go.
Yeah, so another way that we work with state affiliates is our ACT network alerts, and I know that I mentioned that our tracker is on the ACT network, but the ACT network, this is the foundation of it, is lawmakers are most likely to react when they hear directly from their constituents, so directly from oncologists in their district. And when we hear from a source on the ground, we often work in coalitions, and when we hear that there's a piece of legislation that's stalled or that needs an extra kick, or if there's a bill that we want to block and it's about to hit the floor, we can set up an alert really quickly, and then we're here to get that language out the door. We will draft all the language on the front end for members to see, and then on the back end, what the lawmakers end up seeing, and it's all available. The screen is what it looks like on the right, and lawmaker or ASCO members and affiliate members are able to enter their contact information, and it's all hooked up to the correct senator or representative, and then they submit the alert. And we wanted to highlight two recent alerts in both Michigan and Wisconsin. Michigan on oral parity, and Wisconsin on copay accumulators that each garnered over 70 alerts. It's TBD whether that legislation will pass, but we wanted to highlight that engagement as a model going forward. Next slide.
Yeah, and just to highlight some of the work we've already done this year, like I mentioned earlier, we track bills across the entire country, and we're currently tracking almost 550 bills. So it's like Aaron said, states often introduce more legislation and work a little bit faster. So we're keeping up with all those and tracking them, and you can find them on the tracker. We've also sent nearly 30 letters of advocacy already as we head into March. And you can see here that we've weighed in on bills pertaining to copay accumulators, drug affordability review boards, fertility preservation, restrictive drug formularies, short-term limited duration insurance plans, non-medical switching, and utilization management. Next slide, please.
Telemedicine is there as well in the last few days.
Yes,
so
sorry.
We've done telemedicine too. So going off that, here are some of our highest volume state issues. So copay accumulators really took off during 2021. There are a number of states that passed this as a way to save patients from additional costs and making sure they get the intended discount when a prescription drug offers copay assistance. Drug affordability boards with upper payment limits, and we'll get to a specific case study of this later. But lately, a trend in Colorado that emerged in Colorado, Oregon, and this year in Washington, states are putting forth these drug affordability boards, which have the power to set upper payment limits, and that can be very harmful for oncology, in that some of the drugs selected for those affordability boards might be oncology drugs, and it may put the provider in a position where he or she has to front a cost for a drug at a higher level than what they get reimbursed at. So this is a trend that we're watching closely, and there's an effort in Washington right now, and Colorado is set to be implemented, and it'll be interesting which drugs they choose for that affordability board. Gold card prior authorization exemption. So the idea here is if a physician has a good track record of getting prior authorization approved at 90 or 95%, or states are rolling with different numbers. The idea is that they can get a gold card and bypass the prior authorization process. And this is something that passed in Texas last year. They're having a few hurdles in the rulemaking process, which is something that we're watching closely, and it's something that the GRC gave us the green light to start weighing in on this year. So I think Sarah's tracking a number of those, and Colorado is the one that's moved. And then Medicaid expansion, 38 states have expanded Medicaid. There's one state right now trying to go backwards with Medicaid expansion, that's Missouri. They're trying to put forth a ballot initiative that would allow the legislature to decide on a year-by-year basis if it has the appropriate funds to offer Medicaid expansion for the expansion population. So that's something that's concerning to us. We've sent a letter. We've used the ACT network, which we went over before. So that's something that we're watching. And then South Dakota is going to have a ballot measure for expansion at the fall and in the November election. And then in North Carolina, there's increased optimism. There was a report yesterday about increased optimism with the Republican Senate Majority Leader that they may actually be able to get something done on Medicaid expansion this year. And that's been a long time coming. It's an issue that it's no coincidence why those 12 states have held out. They've held out for a long time. It's been very difficult politically in those 12 states to get it to move forward. But slowly but surely, more states are starting to expand and take the money from the federal government to give more of their population high quality health insurance. And we wanted to also offer another poll following this slide about if we're capturing the right issues.
Please, Marie, were you able to pull up that poll for the last slide? Yeah, there we go. So the question is, which of these issues is your top priority, or if there's another issue that you feel is your top priority? We'd love to hear about that. Julie in the chat says PBMs. It's good to know.
Great, Naveed. Yeah, thank you. Thank you for writing that. And if the answer is other, definitely feel free to write that in the chat, which issue it is.
Okay, so it looks like responses have slowed down.
As Luann noted in the poll before, some of the attendees watch multiple states, so these questions we realize are difficult to answer. But yeah, so it looks like prior authorization, step therapy, and copay accumulators. We're running the table here. And we can go to the next slide.
Okay, so like Erin said, we wanted to do a case study to show how we can work with y'all on issues that are really important to your state affiliate. So we wanted to highlight the Washington Drug Affordability Board legislation in Washington State and how we've kind of been working on that and the process for that. So in December, we identified a drug bill that was filed during pre-filing, so before session started, and we reached out to the Washington State affiliate and their lobbyist to kind of start conversations on this bill. And after numerous strategy calls with the lobbyist and with the board, we coordinated meetings with key lawmakers, including the sponsor of the bill, and drafted a letter of opposition that outlined some of the concerns with drug affordability boards that Erin mentioned before. And those conversations resulted in the Senate committee adopting our proposed language to carve out physician-administered drugs from a potential upper payment limit. The bill is still moving through the House now. And as it continues through the process, we remain in communication with WSMOS, but did just want to flag that it's changing every day, the language. I know we got an alert this morning that there's been another amendment. So it's just something we remain in constant contact with WSMOS over, because it's great to hear from them about their concerns and make sure that we're covering everything. And because it's moving so quickly and it's changing, I think the relationship we have with the Washington State affiliate has been super, super helpful. And it's a great example of how we can collaborate with y'all and lawmakers and lobbyists on the ground to make sure we're addressing your concerns. Next slide, please.
Thank you. So yeah, we wanted to sum up a little bit with what we just went over. So to highlight, we want what you should do on the phone, or what those of you on the phone should do to get involved in state advocacy, is first contact Sarah, myself, or Jen with concerns, and then explore the state bill tracker, which is linked in the chat and on the ACT network, and then join the conversation on my affiliates, which Lisa Marie and Terry do a great job of running. And there's been a lot of increased participation, and it's something that Sarah and I check every day to see if there's new messages and new threads, and it's a great way for different state affiliates to keep in touch with each other. Next slide.
So I wanted to open it up to questions, but first wanted to put our emails up on the screen. Like Erin said, please feel free to contact us at any time. We are here to be a resource to you, and we want to help you and get to know you. I especially want to get to know you as someone who's new to the team. So don't be shy, shoot us an email. And with that, I think we can open it up to questions and discussion. Oh, Lisa Marie, I think you're muted.
Sorry, my apologies. It does look like we did have a question that came through. Does ASCO work with other physician groups or patient groups on state issues?
Yeah, I can answer that one. Yes, we are a part of 2 coalitions right now, and we work with as many groups as we can on a different issue, because the more the merrier, and coalitions are what really help advance the ball forward. So we're part of the same coalition, so that's the State Access to Innovative Medicines, and they work closely on step therapy, and we joined that group at the very beginning of 2020, and they've been very helpful in working on step therapy bills this year. Kentucky and Tennessee are moving. And then we're also part of the All Copays Count Coalition, which has been increasingly helpful with the copay accumulator issues. So yeah, coalitions are a key part of our advocacy work. And I think Angela from Mississippi has a question.
Yes, she does. Hi, Angela. I believe your line is unmuted.
It is. Thank you. I just wanted to thank you, Aaron, for all your assistance recently with us on our telemedicine bill. The letter was very successful, and yesterday we passed out of committee with no problem our telemedicine regulations. So now we are moving forward in a very positive way, and just wanted to thank you for all the support because last year we had quite difficulty with a certain insurance company that was giving us heck. And so we're very happy to report that we're on the right track this year and really appreciate the support from ASCO.
Thank you, Angela. That's great to hear. It's great to hear that it moved through committee yesterday without much opposition.
Looks like we have another question in from Dr. Edel.
Great, thank you. Can you hear me?
Yes.
Okay, yeah, one of the issues, we have 2 bills, both an Assembly and a Senate bill in Wisconsin, looking at white bagging and brown bagging. Can you tell me where other states are at in laws that may or may not have been passed on this issue?
Yeah, so Louisiana passed a bill last year, and it was the first of its kind bill. I think it outlawed brown bagging, and there were a lot of regulations with white bagging. And this year, I don't think anything has passed. I know there's a bill in Wisconsin, a bill in Minnesota, a bill in West Virginia, Ohio, I think New York. And Sarah, do you know of any others that I left off?
No, I think you got them.
We can send you the full list of those bills. I just sent them to, I think, someone in Virginia who asked about that exact same issue. And then also the tracker should have all of that information as well.
Oh, okay.
It looks like
Nebraska,
Carmen
yes.
says there's a bill in Nebraska as well.
Yes, okay, thank you.
And California, popping up everywhere.
We have another question that came through. Does the state advocacy team work with affiliates when states aren't in session?
Yes, that's another good question. Yes, we do. And I know that states are not in session year round like Congress is. And during the interim, that's when we huddle up as a team to see what went well this past session and how we can continue to work with affiliates going forward. And we try to schedule as many different one-on-one calls with as many affiliates as we can during the summer months to sort of recap the previous session and then go forward with the next session. And we know that sometimes we send letters with requests for approval without much without much lead time, and there can be a hearing tomorrow and you'll get a letter from us the night before. And we think that the conversations over the summer and just the increased communication just builds trust, and then we can get the letters out the door, as opposed to if you've never seen our face before, we're asking to get a letter out the door with all this approval that you need from someone you've never met before. So we really value the open communication and constant communication, and very much we do work not during the state sessions.
Awesome, thank you. Let me just check. Are there any more questions? All right.
Aaron, I'm sorry, Lisa Marie. Aaron and Sarah, if there is a state out there that has not been engaged in state advocacy, and if there's one thing you could tell them or encourage them to do just to get their foot out the door, what would that one thing be?
a great question. Might let Aaron take it first.
Say, reach out to us. I know that's kind of a lame answer, but we track bills in all 50 states. We don't favor any state. If there's one state that may engage with us more, it's not like we only track legislation that's coming in certain states. So we track throughout the country, and if there's an important issue, we'll try to be proactive. I know that I won't call out any states on here, but there was a bill that was moving that was very relevant to one of our issues, and then we were able to proactively reach out and get going. So if there happens to be a bill that's particularly relevant, we'll reach out. But we're very open to new dialogue and working with faces that we haven't worked with before.
And I would say, take a look at the tracker to see what states are doing that may be similar to an issue in your own state, because I think it's pretty rare that a state will do something like completely brand new. I think states often are really into trends. So I'm, for example, tracking, like Aaron said, the gold card bill. And so last year, Colorado led the effort, Texas led the effort with that. And we've seen 5 states kind of introduce copycat bills. And that's something we notice a lot in states. So if you think there's something that you'd like to advocate on or oppose, chances are we have experience tracking it and engaging with it. So don't be shy and reach out, explore the tracker, or just contact us and we can tell you.
So it looks like we have another question that came in. Are there issues you don't track or shy away from?
So I'd say the biggest one that we get asked about that we don't weigh in on at the moment is white bagging, because we have members who feel differently about that issue. But what we will do, even if we don't weigh in on an issue, we're happy to analyze the bill. We're happy to facilitate help behind the scenes to help you and assist our affiliates in their efforts. And we did this with drug donation as well. There were drug donation bills in California and Illinois, I believe, last year that we couldn't quite support based on our policy, but we helped Dr. Mirda Dr. Mirda in California with testimony as he was testifying on that bill without weighing in openly. So there are ways that we can assist even if we don't openly support or oppose a bill.
So as it stands, I don't have any more questions in chat and there are no more raised hands. Any final thoughts before we close today's event? Okay, thank you.
I'll also just say,
go ahead,
yeah,
go ahead,
one
Aaron.
last thing. I know that we try to, I know Ryan runs the Advocacy at Home program where he tries to get affiliates and members to meet with their member of Congress. I think something that we'd like to do is state level officials are often a lot more accessible than congressional officials, and that's something that we'd like to support you with too if you have any interest in meeting with state officials.
And I just wanted to say thanks for coming. It's like Aaron said, our partnership with y'all is crucial to our state advocacy work, and we're eager to hear from you. So like we've said a lot, please don't hesitate to reach out.
And in case you all missed their email address, if you'd like to reach out to them, please contact myself and I'd be happy to provide you with their contact information. As I stated earlier, this webinar is being recorded and it will be posted on my affiliates once available. So thank you so much, everyone. I hope you enjoyed today's event and have a great rest of your day.